Healthcare already runs on infrastructure. Health plans process claims. PBMs process pharmacy transactions. TPAs administer benefits. These systems are built to operate in healthcare. Employers are not. Employers fund healthcare, but they were never given the infrastructure to govern it as a system. Medicato establishes that missing infrastructure. We provide the execution layer that enables employers to govern healthcare as an operational system, independent of existing vendors. Because employers lack execution infrastructure, they operate healthcare blindly. Data is fragmented across multiple vendors. Information arrives late. Risks surface after costs are incurred. Employers cannot intervene at the moment decisions are made. They fund the system, but they cannot govern its operation. Healthcare infrastructure was built as systems of record. Health plans record medical claims. PBMs record pharmacy claims. TPAs record administrative activity. Stop-loss carriers record financial exposure. Each system performs its function independently, but there is no execution layer connecting these systems to the employer. No layer that evaluates activity as it happens. No layer that determines when intervention is required. No layer that enables the employer to govern execution. Healthcare records transactions. It does not provide execution infrastructure. That layer never existed. Healthcare already runs on infrastructure. Health plans, PBMs, and TPAs operate the healthcare system, but employers were never given the infrastructure to govern it. Medicato establishes that missing layer. We sit above existing systems and connect them into a unified execution infrastructure. We do not replace vendors. We provide the layer that evaluates activity, determines when action is required, and enables employers to govern healthcare operationally. For the first time, employers can see clearly, understand what is happening, and act while execution is still in motion. Controlled determinism means nothing is guessed. Every signal is evaluated using defined, transparent models. Every recommendation can be traced to the specific evidence that led to it. There are no black boxes, no probabilistic agent behavior, no hidden reasoning. Medicato makes execution fully auditable, fully explainable, and fully governed. Execution authority requires governed access. The cyber access layer enforces this governance. Medicato does not pool data into a single unrestricted system. It evaluates activity and delivers recommended actions within strict ownership and legal boundaries. Employers receive execution authority aligned with their fiduciary responsibility. Members receive only their personal recommended actions. Each vendor system retains ownership of its operational domain. Medicato governs execution across systems without violating system boundaries. This allows execution infrastructure to exist without disrupting existing healthcare systems. The cyber access layer makes execution governable, secure, and scalable. Before Medicato, employers could observe healthcare only after execution had occurred. They received reports weeks or months later. By the time risks became visible, the opportunity to intervene had passed. Medicato changes this model completely. The execution layer continuously evaluates healthcare activities as they occur. It produces recommended actions that define when intervention is required, who should act, and where execution should occur. Employers move from retrospective reporting to operational governance. Healthcare becomes a governable system. Execution becomes possible. The execution layer operates through structured recommended actions. Medicato continuously evaluates claims, pharmacy, eligibility, and utilization. When action is required, a recommended action is produced. It defines what is happening, why it matters, and who must act. These actions are delivered through two governed portals. The employer portal enables operational governance. The member portal enables individuals to act on their own care. Medicato does not replace healthcare systems. It makes them governable. Medicato is licensed as execution infrastructure by employers and participating healthcare vendors. Self-insured employers deploy Medicato directly and operate within their own secure execution domain, with full governed authority over their population and vendor ecosystem. Fully insured employers access Medicato through their health plan, with execution visibility and recommended actions aligned to their governance role and contractual boundaries. Vendors participate as execution nodes. They retain control of their systems while receiving governed recommended actions to execute within their domain. The member portal extends this infrastructure to each individual on a per-employee per-month basis. Medicato does not replace existing systems, it activates them. Employers now move from passive buyers of healthcare to operators of it.